Thank you for joining us for Medical Minute. I'm your host, Chastity Darfus, and I'm joined today with Dr. Anthony Mark of our Bariatric and Metabolic Surgery Clinic. Hi, Dr. Mark. How are you today?
Hey, Chastity. How are you?
Good. Tell us a little bit about yourself and what you do here at WVU.
Name's Anthony Mark. I am a prior military guy. So I served in the Army for the last 20 plus years, not to date myself. And I am currently transitioning here to, not currently, I guess I'm here at Berkeley Medical Center starting a bariatric program. Focus being medical and surgical, but right now we're kind of targeting surgical patients in the area and in the market to really address some of the longstanding issues that we've had in this market, just about obesity care, and kind of consolidate all of that level of care, so that way patients have a place and a resource to go to get care that may be surgical or may not be surgical. So it's a big undertaking, but we seem to be getting there, and the community is very passionate about it. The organization's very, very passionate about it. So it's been a very nice transition so far.
Good. Can you tell us what is bariatric surgery?
So bariatric surgery is very complex procedures that we perform in minimally invasive fashion. Minimally invasive means with the latest technology, robotic surgery, laparoscopic surgery. The way I explain it to my patients is that bariatric surgery come in two categories. It's restrictive, and then there's a combination of restrictive and malabsorptive. So restrictive is reducing certain parts of our anatomy in such a fashion that it goes from 100% down to 10%. Due to that restriction, people are able to curb appetites, curb dietary activities just because of the restriction, and then they're able to have successful weight loss. What's successful weight loss? We see a lot of weight loss over 12 to 24 months, and in that time course where patients are having this intentional restriction, we're able to do a lot of patient education, nutritional education, exercise physiology education, and as we treat the weight and the weight comes off, patients start to feel better, the energy goes through the roof, and they start to regain control over at least the physical aspect of their life. Mental health gets better, so there's a lot of benefits that come from actually treating obesity, and we offer a surgical option.
Okay, and are those all pieces of the program that's here at WVU Medicine? The dietitian, nutrition?
Yeah, it's a 4-pillar program. So I always tell folks, even though we get focused in on the surgical intervention, surgical intervention may take 2 to 3 hours, sometimes less, sometimes more. So it's a snapshot in the overall program. It's a critical part, but it's not the program. Nutritional education is probably the foremost important piece that we actually provide patients. So even when I talk to patients and they may not be necessarily interested in surgical interventions, I say everyone should be interested in medical. Right. And so just getting that information alone is probably well worth its weight in gold. There's also a mental health aspect. I've been doing this for a very long time and having a lot of conversations with a lot of different folks, whether they're struggling with weight, whether they're very much so struggling with weight, over 100 pounds of excess body weight. There's a stigma that they struggle with, everyone struggles with. They're treated differently, they're seen differently, and then when they lose the weight, they're treated differently again. But they're still the same person. So with that, there's a behavioral health, mental health approach, because we want to identify any type of issues that may not be known to the patient. They may have addictive personality disorders, eating disorders. These all come up in this preoperative evaluation, and so we use it as a component to make sure that our patients are well taken care of. I call it a global health assessment. We also send folks to physical therapy because over the course of our life, every day that we live, we're one day older than we were. So I joke with my patients when I say we're no longer 20. 20 was our heyday, right? So comfortably moving into the after years of 20, we may not be as physically spry, even though our minds say we are. Physical therapy just meets us where we are so we can get our bodies moving again. So that way we don't feel intimidated by the term exercise or going and figuring it out on our own. We want to meet folks where they are and then come up with things that make sense. Like if you can't go run 100 miles, maybe just walking 5,000 steps. If you can't lift a ton of weights, maybe doing some resistance bands. There's always something that you can do sitting in a chair or getting up outside. And so we try and figure out what that is. And so that's where our physical therapy comes in. And then the component of surgery, it branches two ways. We do medical, and so we have a pathway that's growing for that. And then we have surgery. There's a pathway growing for that as well. Focusing in on the surgical side, we talk about all the complexity of surgery that goes into the decision making and then what's available for the patients. We also talk about risks of surgery and what have you. So try and make it a very comprehensive conversation. And it's a conversation that we have to have several times, but it's a conversation that we have and we grow and we build on it.
What would you say is the idea bariatric candidate?
Someone motivated.
Okay.
Like I always like to joke and say, I've been very blessed and fortunate over my career to have a lot of experience. Very blessed and fortunate in my military career, my career here, to just have great people I work with. So I've always been surrounded by great teams. So if you're on a great team, you can do great things. But it doesn't matter if I can if I can mold something, phenomenal, if the person is not motivated to take care of it. So we usually in our field, we talk about that we give you a tool. It's a very effective tool. It's a very powerful tool. But if you just like any tool, if you don't keep it sharp, it can wear down and it can create problems for you. So we go through a lot of that. We spend a lot of time talking about that. My partner and I, we're very passionate about this and making sure that patients are well taken care of and they have good outcomes. That's our biggest thing, because we make a permanent and lasting change inside someone, and we want them to be safe 20, 30, 40, 50 years from now.
You've talked about the 4 pillars of the program. Can you talk to us a little bit about what the patient journey looks like from start to finish?
So it's not an expressway. It is exactly as you described. It's a journey. So a lot of, there's an overarching organization called the American Society of Metabolic and Bariatric Surgery. They're an organization that's great. In the last 10 to 15 years, they've very much so organized and made surgery safer. So we follow all the same tenets. Both my partner and I, we come from places that we were accredited as centers of excellence for bariatric surgery and medicine, and so we're reproducing that here. So with that, there's very strict criteria that we put forth for the patient for their own safety. So they have an initial consultation just to talk about the program itself. So that's one set of meetings. And then they'll have an appointment with their primary care to say, yes, we think that this person's appropriate candidate to go down this surgical pathway. We call it a pathway. And then there's additional appointments, like we said, there's 4 pillars, so you have to meet with a specialist in each one of those 4 pillars. So the patients do commit a lot of time, effort, resources to being successful. And again, the most important part that I keep always going back to is the nutritional aspect. They'll be put on a dedicated nutritional plan. They'll gain a lot of information. And so this is all a commitment by the patient. At the end of that commitment, then they have an option. They have an option for, which tool do you want? The tool come in various flavors. We offer everything here. So if you've heard of it in bariatric surgery, we have the experience to deliver it. And then we also have the experience to say which ones are better than others based on the individual.
Can you share a testimonial or a success story that you've had in your practice?
I can share statistics. Like my patients all tell me that they're very grateful afterwards. So by name, I guess I can't give you a name, but by procedure, I can tell you that each procedure I have a lot of success with. Patients lose the expected weight. I'll give you an overall, I guess this is a better way to answer it. Like if a patient is on curve losing weight, they are exactly where they need to be. And so our engagement ends up being coaching. If the patient is not losing their weight like they want, then our engagement's a little bit more structured, because some folks may be just metabolically resistant. And so there's patients like that I have to incorporate medical aspects and introduce medications, and they're grateful for that, because they will. My goal is to lose weight on the trajectory that you're supposed to, maximizing this tool. And so patients are very grateful for that experience. I always tell patients, and they're grateful for this, they have filled out Google reviews, so you can, I guess, read the Google reviews. But I tell them that this is a journey that they're not alone. Like I'm like a shepherd on this journey, because their anatomy has changed, their reality is changing, and so my goal is to guide them through those changes and be a help. So when they're struggling, if they're struggling with mental health, like a lot of times after surgery, people are just a little depressed because now they're physically changing and they're physically being seen differently. I've told folks they've been like 4 or 5 months after surgery, and they're like, people walk right back past me and don't recognize me, or people are seeing them for the first time. And so these are all the importance of the behavioral health and the mental health aspect, because it's a thing that, as not walking in those shoes, we don't see. And so my patients teach me a lot, and then I try and bring those experiences to my other patients, so that way they're not lost in it. So I don't know if that entirely answers your question, but there is a lot of, based on what surgery patients go with, there's a lot of success. There's risks. We mitigate that all the way down, so I don't have, like I can name on a hand complications over thousands of cases. Complications being like bleeding complications or, a staple line failure or something like that, but I've been able to take care of everyone. And so with that said, even in those instances, patients are very, very grateful. So it's a great field, and the patients are grateful overall, which is why I do it.
Obviously, there's a lot of positive impact to mental health, their physical health as well. Yeah. What would you say in your practice that you've seen as the most positive benefits that patients experience or have expressed to you?
Everyone says, and this is actually when I really got committed into it during my fellowship training, they just came in saying, "Thank you for giving me my life back," and I found that like very, very powerful. And it's like, I've struggled with weight, and I've been 40, 50 pounds overweight. And it was hard. It's hard to get down, and it's hard to lose that weight, and weight becomes self-protective. And so patients, when you're struggling and you're 100 pounds overweight and they're doing all the right things, people start to stigmatize you. And it's unfair because they don't understand the physiology and the chemical nature of why you can't lose weight. That's why you never seen a 100-pound or the Biggest Loser reunion, right? That's because they all end up failing because, again, you're not given the proper tools. So I lost track of the question.
The patients express the biggest benefit that it has to their lives
is actually getting their life back on track. I have a lot of folks that are young, I guess are new young, because I'm in my 40s, and so they just want to play with their kids. They're able to get up, play with their kids. They want to be able to walk in the mall, and they want to be able to not stop. They want to be able to get on an airplane and fly somewhere versus drive somewhere. It's called non-scale victories, stuff that we take for granted. They want to be able to put on a seatbelt and not have an extender. They want to be able to ride roller coasters. So all these things that they missed out on, they're really, really grateful, and that's what they feel like they have a second lease on life. And I try and tie into that. I try and tap into that because, like anything else, if you break a tool, it doesn't necessarily mean you can recreate it. And so that's why I'm very much so, like, our program is very much so entwined with the patient, and I tell them we're kind of like their bonus primary care center, because when they have different issues, what have you, we want them to come and see us, and then we help navigate some of those things because their anatomy is different, their physiology is different, and it's those things that we focus in on as being bariatric specialists, that we really try and make sure that we help our peers and our colleagues also understand that things may not be exactly the same. So that's a part of what the patient's experience. That's my experience with the patient. That's kind of the full circle experience, I guess.
Okay. So you've talked about surgery is a tool, one of the tools in the toolkit, and you're walking through with that patient through the journey. How long do you stay with the patient after their surgery? How are we ensuring their success post-bariatric surgery?
So that's actually an excellent question, and I joke with my patients because I like to make sure that we are all comfortable because we're in it together. I always tell them, I was like, well, we're partners in this unless you fire me, then it just gets awkward. And I joke with them as well and saying, like I want to be grocery store friends, and that's my goal. Like I should be able to see you in the grocery store, be like, hey, bye. I don't need to see you all the time, but I want to be engaged. So the way that we keep that engagement is that I tell them, like, after the first 2 years, there's a lot of like follow-up in the first year. It's twice a year for the second year, and then it's annual thereafter. Okay. And we're there with them for the rest of their life. As long as I'm here and the program's here, they can follow me. I have patients from where I was before that followed me here. And that's because, like I said, I become the bonus primary care person and make sure that, you know, things are happening. I have patients call me and be like, hey, I got a cold. Can I take this medicine? And sometimes I'm like, yes. And sometimes I'm like, no, you can't. And then I'll make suggestions and I'll ask them if they need me to call their primary care, and I'll call their primary care. Just to make sure that there's different things that certain patients can and can't have. Certain times they can't have steroids, or if you have to do steroids, there's different medication you have to layer on with that.
Right.
But sometimes the primary care or the specialists don't know that, because that's my wheelhouse. So I tell my patients that they're kind of stuck with me until they decide that they don't want to be stuck with me anymore.
And do you collaborate? I know that it is a multidisciplinary approach. Do you collaborate with the patient's primary care physician?
Yeah. We have all these. The great thing about our electronic medical record is that everybody's kind of tied into Epic. So, you know, I was Epic chatting with primary care docs last night till like 7, 8 o'clock at night about patients that we're coordinating up. And then if I have a question and they're in our system, I just reach out to them on their behalf and see if we can just make things smoother, so that way it's less burdensome. Our clinic staff is also there to support them. So, you know, if they can offload some of those queries, they also take that burden on, just so that way the patient experience is not as disjointed.
What would you, as we're coming to a close, what would you recommend or say to a person who's feeling nervous about bariatric surgery or has maybe some misconceptions about it?
Yeah, just come for a conversation. I lead in, and Dr. Zubowitz and I kind of have a very similar patient care approach. But I always talk to my patients and I say, we're here to have a conversation. I'm not here to tell you that you need one thing or the other. I'm just here to tell you what the information is. And then at the end, I have empowered you with information, and you get to choose what path you want to go on. I always encourage everyone, even if they don't choose surgery, they should all choose a nutritional education. If you asked 20 patients or 20 people, you will get 20 bad answers when it comes to nutritional education. So I always tell folks, or at least like the majority, I always tell folks, if there's nothing else more important, it's that focus, because we're going to talk about volumes, proteins, carbs, like just balance, healthy life balance. Just getting that information can be life impacting and changing. So if nothing else, the program will at least get you that, and it'll give you kind of like at least a framework to build a house around.
Okay. Well, that's all we have time for today, Dr. Mark. Thank you so much for joining us. And we hope that you join us next time for our next episode of Medical Minute. Thank you.
Thank you.